Hi, good evening. Mr. Muntair is an elderly gentleman who is from Iraq and has come to us with presentation of perianal pus discharge. And when we investigated and clinically examined him, we found that he had a perianal fistula. It was a complex perianal fistula where there was a transsphincteric tract. That means there was a tunnel-like structure which communicates the lining of the rectum or the anal canal and to the skin outside the anus area. So there is a communication between the passage, normal passage of the stool, with the skin in the adjoining area. So whenever the patient pass motion, sometimes a little bit of pus or stool get tracked out there, and there is a pus discharge to the perianal area.
أنا المواطن منذر صالح محمد من جمهورية العراق. قبل شهرين ونص تقريبا صار عندي حسيت بأورم وراجعت الدكتور بغداد. بصراحة الدكتور سوى فحوصات وما قدر يعرف هذا الشيء. سويت ففكرت انه اجي للهند، وعن طريق شخص صديق جينا الى مستشفى سنار الدولي.
In his case, there was an interesting procedure we did that is called lift procedure. What is the advantage of lift procedure? That we can prevent, because he is an elderly gentleman and he had a complex fistula. If we remove the entire tract and try to do an extensive surgery including the tract excision, a lot of sphincter damage can happen. That means the muscle which controls the normal passage of stool, and this patient have a risk of having a incontinence. They have to lose control over the stool. So in the lift technique, the advantage is that we do an intersphincteric ligation of the tract as well. So what is the advantage is that we will prevent any damage to the muscles or the sphincters controlling your continence. So the patient doesn't have any problem in the post-operative area to hold the stool normally.
وبصراحة لقيت عناية جيدة وسووا لي العملية، والعملية ناجحة من قبل الدكتور فيناي شو، والعملية ناجحة والحمد لله والشكر. الأمور زينة وأنا هسه حالتي مستقرة وفرحان ومعنوياتي عالية، وأنا أشكر المقيمين بالمستشفى اللي بسوي بمستشفى سانار الدولي.
So and this patient did very well, and we did a lift procedure. The external tract was excised and we sent it for biopsy, and the biopsy was benign findings, and the patient is doing well. He is able to pass his stool normally. He has full control on the stool, and his wound is also healing, and he is doing pretty well after surgery. And that is the advantage of planning and executing well. Perianal fistula can sometimes be very challenging to manage, and there must be we have different types of algorithm in the management. There are different types of procedures. Sometimes we also do a laser fistula surgery. Sometimes we have to resort to a lift technique. So knowledge of various approaches does help us in better manage these types of patients. Thank you so much.